This afternoon, we will watch excerpts from interview number 42, in which Les is asked to help out with a woman presented as very aggressive and abrasive. This is the main problem that the residents present to him. This tape is interesting on many levels, not least of which is that Les was way ahead of his time in saying that the problem is that she is not aggressive enough, but is perceived as unpleasantly aggressive, both directly and indirectly because of the way she's metabolized what she should be as a woman, because she is a woman. He also proposes a very active role for the therapist. He distinguishes between long-term empowering work and a practical intervention needed in the moment, regarding the woman being potentially cheated by her husband in the divorce settlement as a clinical emergency. Finally, after that, we'll watch a portion of tape number 41. This lecture on the nature of hallucinations and the imagined biography of Admiral Peary is classic Les, and many of his students will remember it fondly.
And that's not good. And I mean, I don't know whether it's, I should keep my mouth shut. But I've been through so many of these things in which this sort of thing has happened. And when women are aggressive, they're accused of being pushy, and that helps them back down a little bit from doing what they need to do, and then they get fixed. She's got lots of vitality, got lots of courage. She's on her way. She's able to date now. She's going to go along. She's probably pull it off again. But it would be a shame if for the fourth time, in this case in her life, she again had a promising situation that fell apart in her hands. That's not good for the spirit. It's what, in my superstitious opinion, which I should not voice, but I will, that's what makes the cancers grow. And maybe it hurts the immune system. All the bad little viral particles act up. I don't know. Anyway, it's very important to win. And maybe the reason that she has a bad reputation for being pushy and her son won't talk to her is that she's not pushy enough.
We're in the wrong places.
In the wrong places.
Yeah.
Mm-hmm. Or does it with so much internal conflict that it comes across as abrasive.
Yeah. It's one of these people that hollers and then lets you walk all over them.
Yeah.
And so then she's thought of as being a hollering person.
Yeah, well, there's a sort of refusal to take care of herself. There's an element of that.
I don't know who the best divorce lawyer in Madison is. There's usually only one or two good ones. It doesn't attract the best part of the bar. But only two really good ones in Boston. I mean, when you come right down to it. When you decide you want to win and not just, play croquet in the afternoon.
Well, I'm curious about how you think how you think you can work with people who sort of refuse to take care of themselves. I mean, in some ways, that sounds like what she's been doing. I mean, the classic case is the woman who comes into the emergency room beaten up time after time, and you say, go to the Batter's Women's Shelter, leave your husband, take care of yourself, my God, and they don't do it. I mean, what do you do? What do you do with those people? Or men that don't take care of themselves, if I may say so. A lot of those, too. Boy. Well, the answer that our profession has given. 4 answers our profession has given to this question. The first answer is the one you hear least nowadays, although you used to hear it all the time. People who come in with a sad story. Some people, we used to call them psychopaths because they would blame other people for their problems, which is characteristic of many psychopaths, in fact. But we often would dismiss them that way. You don't hear that so much anymore. But the 3 other stories we tell are, one is that the person makes poor selections and can't tell a wolf from a lamb.
Point number two, and this is very popular nowadays, is that people somehow generate bad behavior from other people. In other words, they know how to turn on the worst in human nature, or doing what's called bringing out the worst in other people. And that's a very tempting idea, because, I mean, one of the advantages of having been around a little bit longer than some of you is that you get a chance to watch your friends get married. And you watch the transformations in personalities that occur when people get married. And I've seen people who I thought were, you know, reasonably quiet citizens of the nation and, you know, meek soldiers of the great republic. And they married some nice girls who really adored them. And Jesus, 3 or 4 years later, you'd think that they were Adolf Hitler. Well, this is an old constitutional principle in the British monarchy. That is the idea that power corrupts and absolute power corrupts absolutely. And I know a few friends of mine that have become beasts in the process of being taken good care of. It's my quarrel with the Christian church. It's the same quarrel Nietzsche and Marx had with the church. You treat some people well, turns them into monsters. And picking the kind of person you can treat well is one of the great arts of life, of course. But anyway, that's a principle, the interactive principle. Those who bring out the worst in us. And then the third principle is the one that's most used, actually, still, and of course has also received the most abuse. That is the idea that people who are abused want to be. They have one of two failings. One, they have too much masochistic instinct. So in some weird way, they are enjoying being beaten up and knocked around, raped, more or less deprived of their personal liberty. That's a very popular one. Or second, if you don't believe in the instinct theory of disease, you decide that the reason that they get beaten up so often is that they are enamored of and idealize the martyr position. And that they're emulating the good Jesus and want to be dying on the cross. I think those various principles, psychopathy, bad selection, interactive effects, masochistic instincts, or idealization of suffering, pretty much cover the waterfront of why people do, at least our theories as to why people do these things. As for the correction of those conditions, a lot would depend upon which it was. I mean, for example, if you were very bad at selecting nice people, you need a good guide to pick out the wolves from the sheep. If you have interactive potentials, if you're being too nice to somebody, turning them into a beast, then something ought to be done along those lines, right? Or thirdly, if some of these instincts are true or idealizations are true, maybe there can or cannot be done much about that. Generally, the analytic position has been that you should become aware of your instincts and then control them. I don't see much gain coming from that attempt, but that's what has been often taught, and maybe it's true. I have been very much interested in the idea that behaviors shape each other, and that people sometimes can profit seriously from being coached or trained in not encouraging bad behavior. I gained some of my courage in this idea by noticing how few people can abandon their good manners, even in appalling situations. My favorite example is people who can't hang up the phone. I know people, if you call them up and begin to abuse them, call names, this is how some of these obscene phone call people keep in business. You go on saying perfectly awful things to them, they hold out of the phone, and they keep it, even next to their ear. And that's an amazing phenomenon. When and what I do is I say to them, now look, practice just taking this plastic thing and putting it back on that funny little carriage that comes with it. Huh? Just try it. For example, when your mother calls up on Sunday night to inquire after your so-called well-being, and And she becomes so uningratiating, so painfully intrusive, such a giant pain in the ass. Just try, in the middle of the conversation, just putting it back on your thing.
There's some evidence to back that in the sense that she was tempted to tolerate him going for these affairs and even risk getting, considerable risk of AIDS.
So for all her feistiness, it's not as feisty as she ought to be.
Yeah, I think that's right.
Well, and if you carry that ahead, then you ask, how's she going to manage her own dependency? Who's she going to depend on, and how's she going to confront?
Well, now you're talking about long term. If she wants to come back and talk to one of the folks about, how she keeps this thing from happening again, that's another story. She can't make her do that.
But can't you hypothesize that going ahead with being her own advocate then puts her in a position of having to, I think perhaps one of the things that happens is she doesn't sort of acknowledge, I get the sense she wasn't even acknowledging that this had happened to her. By not acting, it's like she can pretend it's not happening.
I agree with that.
And it seems like one of the things that she has to confront if she gets more clear about the fact that it actually happened is that she doesn't have anybody to depend on. And these men who she thought were going to take care of her aren't there anymore.
I was wondering your thoughts on the extent that she's looked up to her father and to her husband, and they've let her down in disappointments on 3 occasions. How much of a risk is Andy at recapitulating that situation, and how can he avoid that? Or
By getting a good lawyer.
Himself?
himself, or?
You're making sure she does. Bugging her about it. Because otherwise, he is colluding in what is a self-destructive path,
Yep.
and he is to blame. How is a psychiatrist going to help a divorce settlement? That's not our idea. That's not our thing. Now, if she was a paranoid schizophrenic personality, he might have to go to court with her to make sure that she stayed there and didn't screw up the law case. That might be necessary for the thing to be carried out properly, but in this case, that's obviously not necessary, I would think.
Couldn't one be colluding in her submissiveness that way by being a coach? Rather than having her take the initiative?
That's a good point, but this is an emergency. If things were fine, you could work up to that slowly, and then you wouldn't. But at this point, if you let her down, you have a right. She has a right to be furious. This is something she does not know how to manage. If the example of these other cases is significant, I may be wrong about that. These other instances. So I thought I would give you a lecture on hallucinations. But then I realized that it's almost time for lunch. You know what Winston Churchill said about mathematics? He said, once upon a time I understood all of mathematics, he said. Sines turning into cosines, infinity, it all paraded before me like the Lord Mayor's parade. But it was after dinner, so I let it go. Before lunch, so maybe I let this go. One of the most interesting, one of the oldest problems in psychiatry is the difference between the saints and the mad people. Harvard's greatest gift to philosophy was, of course, William James. And he wrote a book called The Varieties of Religious Experience, in which he explored the difference between mad people and saints. And the differences are hard to come by, since many saints are hallucinated, suicidal, incoherent, bizarre, etc. And so he did what others too have done, tried to separate out the two. In keeping with that man's philosophy, he decided the difference between the saints and the mad people was that the saints' lives turned out better. They had more friends, they had better followers, they ate better meals, they were less often in the back wards of hospitals.
They were more remoralized than demoralized. So that presented a nice problem to us. Because maybe the psychiatric profession, which on the whole looks down its noses at the whole idea of a moral psychosis, for example, who would really had a terrible time conceiving of an illness as having something to do with sin, even though the two, at one time in the history of the world, were not very far apart. Anyway, that presented us with some formidable opportunities and dilemmas. Well, to go about this systematically, and God knows why I should be trying psychosis to lens, but to go about this systematically, right, you might want to know a lot about hallucinations. Just simply taking that as one small facet of this complex clinical picture. Now, under what conditions do people hallucinate? The answer is under almost all conditions. Everybody hallucinates at night in sleep. Many people hallucinate on falling asleep, especially if you're younger. Some people can hallucinate at will, especially if you're young. Some people can hallucinate, however, even when they're old at will. Toscanini was supposed to be able to read music and hear it at the same time. Goethe had a private television set, a little box he could put in front of him and see his imagination. Children do that. That's called being eidetic. Then there are, of course, 1,000 other things that make you hallucinate, from mescaline to sensory deprivation to sitting in the desert on a hot day to a million other things, right? One of the things that's most interesting that makes you hallucinate is danger. There's extensive evidence that you hallucinate if you're in sufficient danger. Now, I don't mean the kind of danger you're in. I mean, you're in danger of being bored, right? When I mean danger, I mean real danger, like danger of being killed. For example, when the great Admiral Robert Peary, who wasn't then an admiral, fell down an ice shaft, something he was prone to do because he was looking for the North and South Pole, and there are hazards of such incredibly silly enterprises. Anyway, when he fell down this ice shaft, I don't know whether you know what happened to him, but he reports that he looked up and there was a small sliver of sky, right? And then he was at the bottom of this ice shaft and there was nobody around, really. And the next thing that happened was that a voice said, "God is with you." And the next thing, and this is the part that will amuse you the most, I'm sure, is that he said, "Your left," God said, not Peary, God said, "Your left boot is unbuckled." This is how God gets a reputation for omniscience. I mean that quite seriously. I'm convinced that may be the reason. I shouldn't say convinced, but it may be the reason. And indeed, when the great explorer looked down, he saw that his left boot was unbuckled, a very dangerous thing in an ice shaft. So he immediately buckled it up and did what we call thanking God. Now, when you get in extreme danger like that, God frequently appears. That is a well-authenticated fact. The history of war psychoses is full of it. The history of explorers is full of it. You and I, who lead, believe it or not, relatively safe lives, therefore are exempt from these opportunities for celestial experience. Now, why does God appear? Now, if this were the Wisconsin School of Divine Studies or Theological Enterprise, whatever it's called out here, you know, we would discuss this from one point of view. Since it is not, we won't. But instead, of course, we truck out our notions as to what happens when you are in extreme danger. For example, your mind splits, your mind scatters. And there's the superego part, or the ego ideal part, the conscience part goes in that direction. The ego part, the perceptual observing part goes in another, but they all stay around. I mean, they go a long way away, but they stay around. And so that as I've told generations of Harvard medical students, including your good colleague Jim, that when you go crazy, I've promised them that the way they'll be able to get across the very busy thoroughfare at Longwood Avenue that is in the way of their getting to the Harvard Student Health Services is that as they step across as they go across the street, just when they plant their foot on the dangerous thoroughfare, a voice will say, "Watch out, a truck is coming."
and they'll look up, and like Peary's boot, they'll see it coming, and they'll know they can't go yet. So in other words, our theory is that the ego remains operative, keeps an eye on things, and reports into this fragmented self. Furthermore, those of us who are as lucky as Admiral Peary, when we get in trouble, somebody comes along and says, "Hey fella, you're great stuff. God is with you. Don't worry, I'll get you through." Which is just about the best news you can have, because if you're down at the bottom of an ice shaft, right, with nobody around, and the very great likelihood that that is where you will remain, right? If the supreme being of all human history appears and says, "God is with you," there's a chance that you might not get so depressed or so defeated that you would give up. So if there was any life left in you, this ought to nurture it. And then maybe, if you're a man like Peary and very good in the ice, you would find a way up that ice shaft and get out. And to use it, to mention another prominent divinity, Jesus Christ, that's what he did. He did a number of things. But the important thing is not to be demoralized. The important thing is to notice your boots. The important thing is to get on the ball. And God is a big help, as everybody knows. Not everybody, but as a lot of people know, in making sure that that happens. Now, in the opinion of yours truly, and not so many other people, in the opinion of yours truly, the difference between the saints and the madness is in the kind of advice the two get. Now, my theory is that when Admiral Peary was a little boy, long before he was an admiral, long before he was even a captain, long before he was even a man, he went out into the forest behind the house in which he lived, and he found a swamp. It was one of his first discoveries. I'm making all this up. And he went out and he found a swamp, and it was a very muddy swamp. But he was very proud because he didn't know it existed, and it was a deep place and very exciting and full of snakes and frogs. And he pounced around it for a long time. And when he came back full of his discovery, as proud as punch, he walked in with those muddy boots. He always loved boots. Walked in with those muddy boots and stood on his mother's brand new carpet. Now, Mrs. Peary was a remarkable woman in this fictitious account of his life that I'm giving you. And when she saw her little boy, proud as punch, but dirty as hell, on her brand new, very expensive English carpet, she didn't do what your mother did, and what my mother did, and that most of us ordinary mothers did. She didn't say, "Get your goddamn feet off my carpet." She went to him and she said, "Bobby boy, what did you find today?" I don't think for a minute that entirely fictional individual episode created that kind of relationship with his ideal structures. But maybe it happened a lot. And so that when he was down a big hole, worse than that swamp, dirtier than that dirty place, maybe that kept with him. And so somebody at that moment threw their arms around him and said, "I have faith in you. I know you won't give up. I want you back." Maybe that made the difference between him and most of the rest of us, including maybe our dear friend today, in terms of being able to face up to mistakes. See, Peary made a much bigger mistake than this lady ever made. He was in much more danger than even this lady is in. And yet it's possible, and I want you to know that I know that the things I'm saying are purely speculative. But is it possible that maybe this lady, having made a lot of mistakes, wasn't that beautiful the way she said, well, she'd made a few mistakes and she could forget it and go on, then she made a few more and it got harder and finally made too many and had to give up? Live a little longer and you'll know more of what she means. And maybe at that point, her mind splits a little, and so she begins to hear and see things. But instead of hearing the good Lord saying, "My dear lady, we all sin, come back into the bosom of the church," instead we hear someone saying, "Go kill yourself." The particular vision that our good presenter told us about was that she sees a woman with long hair, was it Mary of the Catholic Church, telling her to go get a razor and cut her wrists. because she sinned 4 times divorced in the Catholic Church, 4 times married, 3 times divorced in the Catholic Church. Is that what it is? Well, as I say, these are speculations, these are hypotheses, but it seems to me that they're possible, that maybe after enough mistakes, our mind begins to break up, and the returns begin coming in on our inner judgments. Notice how beautifully she helped me when I asked her if she agreed with those voices. And she didn't say, oh, those are just voices. She said, yes, she too judged herself as unforgivable. So now we have identification with the persecutory introject, if you like the fancy language of the Kleinians. Well, that's a theory about what separates the bad people from the saints, and it may be a good one, it may be a lousy one. We don't know. It doesn't exclude biological causation, because I bet all those changes must have extraordinary biological concomitants. Who knows what goes on in P2 dopamine sites at the moment in which your mind disintegrates? It must be a big deal down there. There must be things clicking and clicking and all the rest of it that you never heard of before. In any case, whatever the accompanying biological, social, psychological phenomena, it seems to me a lot might be going on. And a lot that's hard to integrate, hard to put back in. How do you forgive yourself? Most of our citizens, when they get down and out, they kill themselves. Large numbers of them. Or they get in automobile accidents, or they drink themselves to death. Or they do all the other ways by which we obliterate our mistakes. Right? But maybe in some of our citizens it takes a more vivid, real form, like this story. Well, here we are then. Say that's true. Say it's just not a lot of poppycock. If there's not a lot of poppycock, it leaves us in a curious position, isn't it? Because what we would like to do is to heal up those separated fragments. We would like to be able to see her home, like Piri, into a kind of integration, a kind of forgiveness. And so that's what I said to her. And she was wise enough to say and agree with me that it wasn't likely that the psychiatric profession was going to be the fount of such a celestial opportunity. And I hope she understood that I didn't condemn her afresh for not finding in us the fountain of all mercy. Because God knows that I don't think many people do. And but she then sensibly said that she would undertake this program perhaps by herself. And in fact, she was doing it. She was trying to figure out a way to forgive herself. And I asked her, you heard me ask her if she had made any progress in that, you know, hoping we could jump maybe on the bandwagon. And she said she was getting somewhere. And then you saw my sneaky insertion there, where I said that I hoped she'd found someone to like her, because that helps in that process, as we all know. You know, so when you go to your friend, your real friend, mind you, when you go to your real friend and tell your real friend how you goofed, you know, and how you now can't go back to A, B, or C, right? And your good friend doesn't say, oh, you son of a bitch, you did it again, but your good friend says, oh, I know, you know, and you begin to heal it up a little bit in that liking. And I meant it when I said that liking is much rarer than loving. People are always going around loving each other. It's a big game. It probably attracts more attention than anything except war. But liking is not so common. That's why friendship is so wonderful, because if you really have someone that likes you, who takes good care of you when you need it, they may love you a little, but they like you. I mean, they like to have you around. It isn't just a question that you're wealthy or beautiful or sexy or powerful. It's just they like you. I mean, God knows what that's about. But they do. And so you go to them and they make you feel good. I.e., they don't make you feel so self-condemnatory. And I was hoping she could find someone that would like her. She's likable. As I said to her, she didn't seem like a bad sort. And she didn't. Most of us don't, given fairly good conditions. And, but I thought, well, one of the nicest, I didn't say this, but of course I was implying it all the while, wasn't I? I was implying that, and I almost did it, but I think I was probably, you tell me whether I was wise not to. I almost said, you know, look around. I said, look around, you know, this mental health profession, they're a funny bunch. I've known a lot of them for a long time, and one thing about them is that many of them have had a lot of trouble. They come to this work honestly. You know, the ophthalmologists, you scratch any ophthalmologist and their little cousin, age 3, died of, you know, glaucoma, or all the orthopedic surgeons had a sister that couldn't walk. I mean, it's, we all get into this work for the same reasons. And most of us know a certain amount about psychological suffering, difficulties. We're worried about being crazy. Scratch a mental health worker and they'll tell you that they're worried about being crazy. And, maybe they're probably right. And so I said, so what I was implying was that around here with our people, there's an unusual percentage of people that are going to like you despite this. In other words, they won't be quite so moralistic or unforgiving as the bulk of humanity. They'll be looking for what you might be worth in their terms. So that one of the ways it seems to me we're useful is that we're more likely to like the patients than most other folks. And we have a lot of wonderful ways by which we make our liking justifiable. For example, we have brilliant theories about how to understand them, which makes them often much more likable. But I think we also deep down like them more. Perhaps because, as I say, we're a little bit like them. And so that was the implication with which I closed, that maybe one of us could make that forgiveness a little bit easier and stamp out some of the suffering. Sometimes something else happens, which when it happens gives us a feeling that we're real pros, but this is not just a lot of hot air, this mental health stuff. Sometimes, after you've been with somebody like this for quite a while, they come in and they tell you, "Doctor, I want to tell you something." They're usually embarrassed about it because it's such an intimate thing. They say, "I want to tell you something. I heard your voice the other night." That was a hallucinated person. "I heard your voice the other night. I've listened to this enough so I don't get too dumbfounded by that. And I also have gotten over the sort of transference problem a little bit, so that doesn't bother me so much. And instead I say, well, I hope I said something nice." And then sometimes the patient says, "That's it, you did. It's the first nice thing I've ever heard from my voices. Now, what I want to happen has happened." Sometimes years later they'll come back to you and they'll say, "Doc, I was about to go crazy. I got in trouble and I was about to go crazy, and instead of the voice telling me I was a son of a bitch, faggot bastard, right? The voice said, it was your voice. They said, well, you're not so bad, you'll be all right. And then I felt better and I didn't go crazy."
Clearly he wasn't dismissive of biology, but he wasn't reductionist. It wasn't everything is about molecules, or pieces of the organic brain. He was very clear in the interaction, the sort of, the more almost dialectical interactions between mind and body and society and things that were happening in people's lives. And the only other thing is, and those of us who trained at Cambridge Hospital will remember Les wandering around the halls at Met State Hospital. Many of us were there for years. And yes, it was a horrible place in many ways, and we kept people away longer than they should have been. And there were many bad things about the place. But interestingly, people, at least the patients on the Cambridge Somerville unit, were not so over-medicated. We were trained that psychosis is not an alien thing, that you talk to people and you listen to them, and that's what you do. And we had lots of time to do it, and we didn't have to write any notes about it, and we didn't have to justify their presence, and some could move on, and some moved in and out of the hospital, but we were actually taught to listen. So it's wonderful to hear this imaginative discussion. It's so graphic about why some people have such negative voices and why others have voices of salvation. And it was so amazing. I mean, we learned from the patients, and we learned from them because we weren't frightened by the things that they were saying. And we were also taught, we didn't have Les's, most of us didn't have quite Les's imagination, but we were learned to hear things as poetry and metaphors. So we weren't dismissive of things that people were saying to us. We were trying to understand maybe the themes, and we could talk back and have a conversation rather than, I mean, there was a whole school more dominant at the time that we were, the psychoeducational school, that we were supposed to be telling the patient, you're schizophrenic, you're bipolar, you're this, you're that. It wasn't quite as tightly defined as it's supposed to be now. But we never did that. We never used any labels with the patients, to the patients. We just had conversations, unfortunately smoking along with them in the ashtrays. But we talked all the time with the patients. That was our entire job there. Obviously, we had to evaluate medical things that were going on or adjust medications, but the majority of the time was spent in just walking around with the patient, including if the patients were a little safer and weren't going to run away or do something violent, that we could walk on the grounds, which were quite nice. We used to call McLean the country club, but the grounds of Met State Hospital right next door were pretty nice too. So when patients had that freedom, it was nice. And so we were taught that it was all on a continuum. We're all human beings here, and it was a way of, oddly, in that horrible setting, treating people with more dignity than I think they're treated now. So,
I want to say something that is obvious, maybe too obvious for people to say it, but there is a nice political aspect to these two vignettes. You know, one is that women can be more assertive and that women get pathologized for doing things that men would not be pathologized for, and the other is a little like the hearing voices movement, that there can be a lot of normality associated with hallucination, a lot of normality preserved, or actually that hallucination can be a normal phenomenon. And I think this, you know, without possibly thinking about it politically, or maybe he did, there certainly was some politics along these lines, plenty of politics along these lines mid-century, in the 60s and 70s, but that there's an admirable and forward-looking or prescient political aspect to these tapes. I mean, I wanted to say more about the psychiatric aspect, but I think we should, you know, start by sticking that in.
He was very committed to the women's movement. Thought that was an important step forward for well-being and mental health. He also really thought Oprah Winfrey was a great thing because people were on TV talking about all the horrible things that had happened to them, and that was a huge breakthrough, that we could acknowledge these things. So I think his approach to women was that they were usually erring on the side of not being bitchy enough, right?
And you're his daughter?
Here it goes, right? My favorite line is Catwoman. Everyone's seen the Michael Keaton Batman, where she's Catwoman and she has the full-length leather suit and she's a whip and she says, "Life's a bitch and so am I." Bob and I will stop fighting now.
There are two basic models of psychopathology. The most popular one is that it's bad and you should get rid of it. You should cut it out or erase it or get someone to forget it or medicate it or teach them that it's wrong so they learn to avoid it. The other model is that it's a complex, alternate set of thoughts, ideas, and feelings which have meaning and are part of the person and are understandable, although it may be difficult to understand them, and are translatable for the patient, although it may be difficult for the patient to understand the translation. And the task of the therapist is to mediate that translation so they're integrated into the patient's mental life rather than extirpated from it. Les is clearly of the second model. I would say that he's right much of the time. I think he would agree that there are times when the first model works and it's a preferable model. And those aren't the patients he's talking about. But by the time he's seeing a patient, by the time we're talking to them, the first model has usually failed or seemed to be patently inappropriate. And then the task is, how do you enter that world and communicate with the patient? His genius was at entering a foreign territory and finding his way around and not being intimidated or terrified by the unfamiliar terrain, and figuring out how to map it and how to even show someone else how they can understand it. This business at the end about his becoming a character in the patient's hallucination, and the role he plays becoming part of the, he doesn't want the patient to stop having hallucinations. He figures out the way to make the hallucinations therapeutic. And then he will conduct therapy from within the hallucinatory experience. The only thing you have to figure out is how to bill in that situation. but the model is the important part, that he's not trying to extirpate the pathology because it's bad. He's trying to understand it and use it as a therapeutic tool in helping the patient adapt to the challenges of life.
Perhaps a biological vulnerability makes for some people to more easily hallucinate without sleeplessness or drugs, but why does Admiral Peary, in his imagination, have good hallucinations and someone else have bad hallucinations? Drugs may make us, be spending different times in REM sleep, but they don't dictate the content of the dreams. So that was sort of the lesson. Maybe some people are more vulnerable to psychosis, but it doesn't make meaningless what they're telling you they're hearing or experiencing. Just they're experiencing it in a different, more graphic and sometimes very alien form. But it's not it's not something that can't be understood usually, or at least related to. I'm not sure of this, but I think Les followed our mutual mentor, Dr. Benarin, and I never even understood what she meant by this for years. I'm not sure I still understand it, but she would say, admire the defense. She said it in a very stern Swiss accent, so it was powerful. But it took me years to even understand what she was talking about. I was too afraid to ask her. But I think it's related to what you're all saying, that so many medications are, there's a reason people don't take them, among, the side effects, obviously, but also because they don't like the effect on them. There's something in it, or something they're accustomed to in the way they're living their life, and if something rudely interrupts that without providing a context or more of a life to go to. I remember wandering around Met State Hospital with this, I can't remember his name, and I couldn't use it anyway. He was a large giant of a guy, and he hallucinated all the time, and we would just walk along, and I don't even remember we talked very much because he didn't speak that clearly to me anyway that often, but we could talk about something, and then he would suddenly just start giggling, and I kind of learned to say something like, it must be nice, whatever is going on. He seemed okay. It was probably of some comfort to him because whatever was going on in that moment in his head, he didn't seem disturbed by it. But anyway.
If I could, I wanted to bring my focus when I was watching this toward Les's role and skills as an educator. We're talking more about the clinical work. And he was just a phenomenal teacher. And it's kind of thrilling for me to see him again. And I'm sort of expectant, waiting. What's he going to say? Wait, where's this story going to go? How outrageous is it going to get? And he was captivating in that way. And when he educated, he was opening our minds, but subtly, not telling us, oh, you should think something else, or that's not true, or not saying, well, what do you think? What do you think? What do you think? He was engaging us, drawing us along. And then through stories, through metaphors, through outlandish, outrageous comments, he would open up. And then at the end you'd think, I don't know. So what is the difference between Peary and this patient? Like, he got you thinking. So he was very active, but very subtle in his teaching. And a lot of my work now is teaching. When I was a resident, Les said to me, Todd, you should teach medical students, I think. He didn't often say very directive things, and I was probably quite influenced by him. So I started teaching medical students, and very, very pleased. It's a large part of my work. But it has led me to think so much about his, not just his clinical work, but his teaching. And they were similar approaches. So I just want to take that different focus and just recognize what a great teacher he was and admire him for that.
And he had a lot of influence on a lot of medical students who had absolutely no interest in going into psychiatry, and then they ran into him. Yeah.
Along the teaching lines, I'm really glad to have seen, or that you all chose this tape that's essentially about position, because I think it shows this other aspect of Les, the analytic mind, that he takes this notion of what the problem is in people who end up dominated in sadomasochistic relationships, or anyway dominated, and he says, look, there's a certain illogic to this analysis. Like sometimes we say it's psychopathy, sometimes we say the person chooses badly, sometimes we say they bring out the worst in others, and sometimes we say they want to be abused. Well, it can't be all of those in any one case, or it would be an enormous coincidence if that were the case. So that, maybe there's a blaming the victim problem here. And I think he, I don't know that he solved this problem, but later in his writing, later in his career, this problem of possession, of being possessed, of being dominated, really was the central problem that he was looking at. And I think he's right that we have lots of pop answers to this problem that are, too easily applied, and whichever one is applied doesn't, look good for the person, who's on the receiving end of it.
Yeah, why was he so nervous in that first interview? He was just all this stuff, and
He was angry about the way the woman had been treated.
Uh-huh.
Because we didn't see.
I'm sorry we couldn't
It's too long
include
to see
it.
the interview, but she'd been told that she was depressed, she was too aggressive, she was trying so hard to speak up for her rights. He was very angry by the time.
Oh,
That's
yes.
what the hammering was. He was
Yeah.
anxious.
I see. Yeah,
Yeah.
I don't know if they heard you, that he was angry at the way the woman had been treated.
Yeah.
Yeah.
I wanted to say one more thing, which is, I had this thought about existential behaviorism. He wanted the resolution to be right. Like, teach the person to hang up the phone, get her a lawyer. It's your responsibility. If she's got a bad lawyer, it's your fault. A good divorce has to come out of this. And it was, you analyzed the problem to some extent empathetically, but the resolution was actually in the world.
Yeah, I think we're talking almost always about these people who are really severely disturbed, psychotic, et cetera, so, right?
She was, I'm so sorry we couldn't, there was just limited time, but she was, he characterized her as a proper French lady. She was an attractive, early middle-aged woman who, if I'm remembering, her husband had cheated on her multiple times and also stolen the business. It was a family business, I think, through her family. And before that, her father and I think brothers, or at least her father, had ruined the business. So she had had at least 3 eras in her life when she had been the victim. And she was a very sensible woman who had a good mind, and she wasn't psychotic at all. The residents didn't like her. And we didn't see any of this behavior with Les in the interview at all. She wasn't at all aggressive with him, but apparently there'd been all these scenes where she and the almost ex-husband were trying to hit each other and so on. But Les really saw her as the victim of this. And again, he said, well, yeah, she's been sort of a serial victim, but a lot of it has to do with her own discomfort from her socialization as a proper French lady, that she's angry, but she's not allowed to express it. So he saw, if I'm remembering, her stuckness as more to do with the position she was put in. And even though it was a chronic and internalized position, he felt like there's an emergency going on right now.
Yeah.
You heard the residents.
Yeah, I get that.
Yeah. I don't think.
I think I'm a long way back from seeing patients, so this is kind of bit distant from me, but I think in the larger scope, with any patient, Les and any of us, really, Les had this strange ability to be just an ordinary guy sitting there saying stuff to people, no matter how sick they were. And it reminds me of seeing how at that horrific McLean that I entered, that I described, where patients were treated really very cruelly. Who helped the patients? They weren't the psychiatrists. They were the social workers very often, but it was often the guy that was emptying the trash. You talk to people after they left. What really helped you? It was the woman who was cleaning the floor, and she came and she had this ability, I really liked her, and she really liked me, and I was able to do that. And I remember, that when I was in practice, I always asked people in therapy at the end, well, what do you remember that helped, that got you better? And I always had certain ideas. And I'll never forget, the one time I'd seen this woman, it was a very difficult patient. I'd seen her for a while. She'd done very well. And the last time, she said, totally unexpected, she said, well, it was that time after my mother died, when as I was walking out, you put your hand on my shoulder. And Les knew about that. Whether he probably didn't put hands on shoulders, I don't know. But he knew what it was like to be connected and a friend, some kind of a real friend to these patients in ways that they can understand. It's really interesting, giving his background and giving all of these things that he was such a brilliant man about, philosophy, psychology, all that stuff. He never lost that. And of course, our big challenge is people who go through this massive education, which is almost all digital, first of all, and rational, second of all, and psychoanalysis, which I saw the worst of in these people at McLean. In some ways, getting into medical school is one of the worst trainings to be a psychiatrist, because everybody's so obsessive. And, there are other, I noticed, there are other ways that are coming along now, which Les and I tried to talk about. But, the mindfulness movement, the 12-step movement, which has at its core what I think Les would really appreciate, that Bill Wilson found, the only thing that could keep a drunk sober was telling his story to another drunk, right? So I'm just kind of a little overwhelmed about that, and he was wonderful at that. He could get there most of the time. I'll stop there.
So that we obviously didn't see the interview with the woman, but what he did there in that situation was he heard a certain story about a patient who happened to be a woman, so he looked at it with skepticism, and then he waded in to what was actually going on in her life and was able to get, I assume, a clear history of the set of injustices that had been done to her. And then he took a stance in the real world about this is what you need to do to help her, which was, he was very busy trying to get himself out of the way of the person. But in this stance, he was like, this is an emergency. Right. I saw a little boy in a hospital, an 8-year-old boy, this summer, and he had a very bad abuse history, and he was terrified. His father had gotten out of jail, and he was terrified that his father was going to come through the window or the door. And we talked a lot about what's going on, and they talked about what medication to put him on, and I told them what medication not to put him on, and at the end I said, this boy is terrified. And he was so fragmented by trauma he couldn't even hold still, but he was actively terrified. And when I talked to him about that, I said, so what are you going to do about that? Maybe he needs an order of protection. What is his legal status? Where is he with child? And it was the same kind of real, what are you going to do for this person? Don't assume that you're going to drug them or talk them out of that. You're going to defend them out of that.
I guess, I hope the audience caught in the film where at least two of the residents took umbrage with his activist stance there, and they said, form and content, it's obvious she's being passive, we need to help empower her to be active. And he said, of course, all well and good, that's the long-term work. Right now, there's an emergency going on, we have to intervene.
And you're not a divorce lawyer, so you can't really help
Right,
her,
you can't help, and she hasn't made the internal changes that are going to allow her to alone advocate, go out there, it's sending her to her, her death. It was very unusual.